we will see how to fill the form or the risk factor for the patient, or also the lab unit, how we'll create requisition, how we will add the test result for the client. So we will go first to the sign and symptoms. We will go to the investigation, the same investigation, and we will write, click yes if it is the sign and symptoms. After that, add. Then it will appear in the schedule. After that, we will click on the sign and symptoms, click save. Sometimes they don't click save, we will not save anything, okay? So you have two options also. You can update the sign and symptoms, or if there's any problem, you can delete it. The same step for the complication. If there is any complication for this patient, you will add it, and you will add the response yes. You will select yes, observed by the physician, let's say, then add. As they said, you will must click on the complication and you will click save. If you want to update the classification or the complication, you can. Risk factor. You select the risk factor, response yes, the date, report date, then you will select the action add. It will be here, then you will click on all the risk factors that you select. After that, you will click save. Okay, so you can save it like that. Truffle history. Sometimes there is disease. It is, let's say there is outbreak in some country. You must add the truffle history for the patient if it is there is any disease in this for this patient. So we will can investigation how this client or how this patient get infection from. So you will add the truffle history, which city that he came from, which country, what is the reason of truffle history, okay? Lab requisition, we have two options for lab requisition: result quick entry or create requisition. Result quick entry, if you have the result in your hospital or the samples examined in your hospital, you will add the result as from result quick entry. If you want to send requisition to another laboratories, let's say you want to send sample to Taif regional laboratory or Mecca regional laboratory or Riyadh, you will select create requisition. So the different from the create requisition and the result, once the result quick entry, you will add the result that you have. Create requisition, you will send requisition, and the laboratory, they will add the result in HESN Plus. So first one, we will go to the result quick entry. We fill all information about the which receiving lab, usually your hospital, the reason of the test reason, diagnosis, the physician request date, then add specimen. You will select the type and the site of this specimen. After that, the collection date, then the test name. You can add one test name, then you will click save. If you have another specimen, you can add it as a new After that, it will appear here, and you can enter the result if there is any result value. If you have any comments, you can add the comment here. If you have any mistake, you can delete it. If you finish and all the information is correct, you will click send. This is the lab quick entry. We will go now to create requisition. Create requisition, the same step, but it's the different. Now you are sending these samples to Mecca, let's say, okay? So you select the receiving lab, Mecca, the region receiving lab directorate, Mecca Health Directorate, receiving lab also in Mecca. So the receiving lab region based on the lab that you want to send the samples, okay? So you select it, and the same step here, receiving lab. the test reason, okay, it will be diagnosis or follow up based on the case or the samples that you have. The same thing, you will select the the type and the site for this specimen, the collection date and the test name. Maybe you have more than one, you can add it and you will click save. If you have another specimen, you can add it as a new one. Then you will click save. Here it will be appear. You make sure before you will click send, okay, make sure everything is correct. Then you will click send. After that it will be, there is icon for print. You will print the requisition with the sample and send it to the lab, okay. You can follow the samples and follow the results from here, from the same page for the lab requisition. You can see here the requisition ID, if there is any, the requisition status for this patient, for this sample, if there is any requisition reason, okay. You can also print it if you want to print it. If you want to see the results, you will enter as on the requisition ID and you will see the results, okay. So here, from here, you can follow up the sample that you sent it to another laboratory.